How do you recommend going about an elimination diet?
So elimination diet, the most important thing is adherence, keeping to it. Because what is an elimination diet? It's hence what it says you're removing something from your diet. And what I
Mhm.
recommend when patients ask me that is, well, what do I do? How long? 2 weeks. So I'll use, as we're talking about MSG as an example. That means for 2 weeks, you're diligent about making sure everything you consume does not have MSG or whatever you're removing because you want to make sure that is this actually having an effect or not. Do one kind of food. If you eliminate a lot of things at once, you're not going to truly know. And patients ask, well, where should I start? If there's certain meals or foods that you have, a thought of it doing, start with that. But if not, you go one by one. 2 weeks, don't consume dairy. 2 weeks, don't consume alcohol. 2 weeks, don't consume caffeine. And, again, you keep to that strict timetable. And if you get those 2 weeks, and you do not notice effect, then it's not a trigger. But if you do notice, oh, you know what? These past 2 weeks, my migraine, my headache, they haven't been as severe, then that might certainly suggest it could be a possible trigger for you.